tell everyone who you are, where you work, and then we'll begin.
Okay, so I am a diabetes consultant. So I am specialise in mainly diabetes, but also endocrinology, that's hormones, and general medicine. And I work at Royal Free Hospital, which is in London, North London. We're not far from you. And then I have lots of different hats. So I work on, I'm a trustee for the South Asian Health Foundation, along with Amal, who's with us today, but also I am on the NICE Guidelines Committee, so I help with updating guidelines for drugs for diabetes. And then I'm an artist. So yeah.
Gosh, so many different hats, and I feel like, you wear them all together sometimes, which is what's so extraordinary. And I can't wait to really talk about that. Hello, Amal. Thank you for persevering. It's so good to see you after all the technological mishaps.
Yeah.
Hello, everybody.
And Amal's the one that put us together. Got us
together. Amal's
so big shout out.
He's the best. Yeah. He's the best GP. Like, let's be honest.
Yeah, he's my art soulmate. Yes. Yeah.
Oh, it's so nice. It's so nice that there are healthcare professionals all over meeting online, connecting through art, because it's such an incredible tool to have for your own self-care, but also, as I hope we're going to discuss, to communicate with patients. And I can see that the lovely Duke has also joined. So I can't wait for you to tell us a little bit more about the work you've done with Duke. So let's start off. Let's talk about the clinical stuff first. Yamaha.
Oh, we've got to be the serious stuff.
Hello again. So let's start talking about your interest in diabetes in South Asian communities. Can you tell the audience a little bit about where we're at with the increased risk in South Asian communities, and a little bit about the stats and kind of challenges that people in South Asian communities experience?
Oh, those are hard questions. Stats, okay.
No, not stats, just general kind of, kind of clinical information, and just talking about, why it is, from your knowledge, that there is a greater risk.
Okay, so I think the first thing is about diabetes. I don't know if everyone knows what diabetes is, but diabetes is a condition that is when the insulin, which is a hormone that we all normally have, helps us move the glucose from food into the places where we need it. So it's into the muscles and the brain to use as energy. And then moves into the liver and the fatty tissue for stores. And when you have diabetes, you either don't have enough of that hormone, or any of that hormone, or the hormone insulin doesn't work. So there are several types of diabetes. The most common are type 2 and type 1 diabetes. Type 1 diabetes is an autoimmune process, so it's something that happens as part of your body makeup and your genetics. And type 2 diabetes, conversely, is type 2 diabetes, which is the most common type of diabetes, is a result of sort of environmental and genetic factors that all play part in causing it. And some of those factors that cause you to have an increased risk to type 2 diabetes, it could be that you've got family history, your ethnic background. So South Asians are at increased risk compared to white populations of developing type 2 diabetes, but also things about sedentary lifestyle and your body weight. And we know that South Asians and Afro-Caribbeans, black communities have to have a lower weight compared to white populations, and therefore, if they're at a normal weight for a white person, they're more likely to develop diabetes. So, yeah.
And do we know why that is at all? Is it very complicated physiologically? Are there any theories as to why that is?
So I think there are some theories. It's quite complicated, but there's this that most people from ethnic minorities generally put that it's about where they put the fat down. So they're more likely to put fat around the tummy, so they have that little beer belly. They might have thin limbs and but fat around the tummy, and that just makes them more predisposed to getting diabetes. So liver fat and pancreas fat, which is all in the tummy. Yeah.
Sure. And in terms of the counselling, in terms of helping South Asian communities mitigating the risk of developing diabetes, what kind of conversation do you have with patients, or are you seeing them when they've already obviously got a diagnosis?
So in my work, I generally see people that have already developed diabetes, because that's why they come to see me, because they've got diabetes. But I do get involved with public health work especially in Barnet, working with our fantastic GP colleagues who really look out for people who are at risk of diabetes, but also I do work with pregnant women. So in pregnancy, we see not only women who've had diabetes outside of pregnancy, but we know that there is an increased risk of gestational diabetes. That's people who develop diabetes in pregnancy. Now, those women that just develop diabetes in pregnancy, that diabetes will go away after they've had their baby. But that's a risk factor for them having diabetes in the future. So it's actually a really good opportunity in pregnancy to get them motivated to make healthy lifestyle changes to make sure that they don't get diabetes in the future. But also I see it as an opportunity, because being a mum, that if I tell them, make sure you do all these lifestyles, your children are going to learn your lifestyle. So if you make, if you go for walks with them and you make all these interesting healthy foods with them, they're going to learn from you and they're going to take those on board, and that's their lifestyle. So it's a good opportunity for public health messaging there as well.
Yeah, and that's, we've got the art in common, but that's obviously one of my prime passions, nutrition and public health, and the promotion of more nutrition education in medical training. So how do you get your patients on that behavioural modification journey? What kinds of conversations do you have to have?
Yeah, so that's really interesting. It's like, so I'm really obviously interested in South Asians, and one of the things I find really fascinating is I love human behavior. I love watching, and that's probably why I've enjoyed diabetes so much. It's about human behavior. Eating is a basic human necessity. It's your basic thing that you need to survive, and how people respond to food when they get diabetes. And one of the things I find really fascinating about, for example, why South Asians come to the UK and they develop diabetes compared to their grandparents.
Yeah.
And it's often because we inherit the food plate that our parents give us. So they've inherited, what their parents or their grandparents were eating back home, but they were more, they were walking. They didn't have cars. They would walk to work. They would walk around, and that was their entertainment, for example, as well. So that, but here you come here and you've got more of a sedentary lifestyle. Yet you're eating the same carbohydrate content and the same plate of food that your grandparents did. So I find that really fascinating. So then I often, talk to them about those concepts. And it's good to get them on board with that, because then it helps them do that with future generations as well.
I couldn't agree more. No, I find it so interesting how people from their native countries, they can live for years and years and they have absolutely no kind of lifestyle related disease, and then they come to developed countries, and unfortunately all these Western habits we have, all the fast food, all the sedentary lifestyle like what you've described, ends up being the thing that's actually going to kind of push them into greater risk factors for developing lifestyle related disease like diabetes, as well as obviously a genetic predisposition. And it's so fascinating, like say, comparing how some of their relatives back home could be completely fine, and it just really highlights the importance of environment, the importance of a really good food environment, and how difficult it can be if you only live by fast food restaurants, etc. And your work is so interesting. And so what kind of responses do you get from your patients when you try and talk to them about these different changes? Do you get met with any sort of hesitancy or skepticism, like, why is my doctor talking to me about this? Or do they generally want to change because that's why they're seeing you?
Yeah, so I think that's a really interesting question, because I think one of the main things that we've found in our work with South Asian Health Foundation is that when there's hesitancy, it's often because there's a lack of cultural competence. So
Mm.
traditionally, people, when they think of South Asian foods, they think of what you eat in an Indian restaurant. And most people don't eat that when they're at home. So you often go, oh, you eat Indian food, it must be, you know, all lots full of oil and greasy, and you have rice and naan at the same time. And so I think there was a lot of hesitancy that they were being perceived, their food was being perceived as unhealthy, but it's actually not unhealthy. You know, when you cook a home meal, you know what the ingredients are. It's not unhealthy. It's just about portion control, and how much carbohydrate you're eating. So how much naan you're eating, and are you eating that? Oh, it's not naan. Your chapati. Are you eating it with a potato vegetable? And actually, those are two carbs. Can we substitute the potatoes for something else? So I think the main thing about when you're having these discussions is about being culturally sensitive and competent with them, and you know, understanding the background and trying to get them on board, because people will build up barriers and not want to engage. So I think it varies. I think a lot of people don't know what is they have misconceptions of what's normal. So you go to ask, when you used to go to ask pasta restaurants, because carbs are very cheap, they give you a big bowl of pasta and you'd think that's a normal portion, and it's not. It's about educating.
No,
What
I know.
portion.
I was reading this book in the last week, and it says that from the 60s to now, the 21st century, the size of our plates have actually increased by 40%. And so we've really not only started incorporating more, you know, foods that are processed that our grandparents wouldn't have eaten, but we've also upped the portion size. So those two kind of factors are really contributing to the kind of situation that we're in right now with poor metabolic health. And it really isn't the individual's fault. It's a lot to do with the environment, as we've discussed, and obviously genetics around it, where you put on that fat. Is it the central adipose tissue going there, or is it peripheral? So no, it's really fascinating. And before we move on to the art, in terms of nutrition, do you feel like when you were at medical school you had enough, or do you feel like you learn as a consultant loads of bits and bobs because it's so relevant to your exact specialty, but your other kind of consultant colleagues in different specialties where it's not, you know, maybe as kind of on paper as relevant, don't know nearly as much as you around nutrition?
It's hugely lacking in medical school training and in training in general as a doctor. I've picked up only because I'm fascinated by it, and also because my job requires it. So I sit in with my dietitians, I talk to them, and it's a necessary part of my job, but it's hugely lacking in medical school. We were not taught it, and so I am so excited about your project, and I think it's really needed. I think people need to be aware of nutrition. Absolutely, makes such a difference to not just diabetes, but to obesity.
I think people think of diabetes as kind of the gold standard as to why you need to know more about nutrition, but from oncology to, you know, any other specialty, you need to know about nutrition. And so I'm really glad we're on the same page. And it's amazing to hear about the interprofessional education that you do by sitting in with your dietitian colleagues as well, because it's just so key to like also not work in silos. And I'm sure they learn so much from you, and like you've just explained, you learn so much from them.
Absolutely.
So yeah, absolutely. And so could you tell us a little bit about the work that you do looking at health inequality amongst communities as well?
So that's mainly via South Asian Health Foundation. So the South Asian Health Foundation, which I'm a trustee for, has been a charity for about 20 years rather, 2 decades, looking at South Asians, but we do look at other ethnicities as well. And Amal, as I've mentioned, is also part of that. And I started my work really because I knew some of the diabetes people on the team, and I'm a part of the diabetes working group. And essentially, what we do is a lot of evidence-based guidelines. So we know that South Asians, ethnic minorities, are genetically slightly, different. We're all different. We're similar but different. And so we try to and I think medicine's really important, not just for diabetes, but anything. It has to be individualized. You try and tailor things to the person who's in front of you. You should be doing that all the time. And so we create evidence-based guidelines to help support South Asians. But then there are lots of community projects. So Amal's doing some great work with our young South Asian Health Foundation fellows, and they're doing lots of community work, working on different areas, not just diabetes, and mental health, women's health, art, lots of different projects. So there's a lot of work going to be going on, and you have to watch this space. It's very exciting times.
I think that's amazing, and I think it's so good that it's so holistic, that you're looking at all the different areas and how they can play a part in every person's journey. And so speaking of art, let's move on to it.
Moving on to art.
Yeah, it's a really exciting area for people to really utilise for communication, but also for well-being. So talk to us a little bit about how your journey with art began.
Okay, so I've come very recently to art in my life. So I at school, I was the one that was always taking the longest because I was a perfectionist, and I used to always think I was making a great piece of art, but my teacher used to walk past and go, "Oh God, why are you taking so long?" So I felt really actually I didn't feel encouraged at school to do art. And also I grew up in a very typical, I don't know if it's typical, but traditional South Asian family where the emphasis was science subjects and what's going to be your professional career. So I wasn't given any incentive to do art at school. So I didn't do GCSE art. I did science subjects and humanities, but no art. And I used to doodle, but nothing in particular. And then when I had my daughter, she was 4, and at her school they told us that she was ahead of her age for art. So we thought we should really feed into that and send her to art school. And my husband said, "Why don't you go to art school with her?" So we had different classes, but at the same time, and I started some of the classes, and it started off with pencil drawings and perspective, and then we had to draw this human skull. And it was the 4th lesson, and I actually found it really difficult. It really I'm such a perfectionist. I could not draw this skull. I was getting everything anatomically incorrect. And in the end of it, I was in tears thinking, this looks like a Power Rangers mask rather than a skull. So I said to the teacher, "I'm really sorry, I'm going to quit." And he said, "No, hang on, come to the next lesson. It's about colour. You might enjoy it. It's colour theory." And I went to it, and it was absolutely blew my mind. I love colour, and I got named the Colour Queen after this. I just found my mojo.
That's why we get on, Colour Queen. I'm in my colour, my favourite colour right now.
Yeah, exactly. So yeah.
Am I right in saying purple is on the colour wheel for yellow, isn't it?
Yeah, absolutely. Yeah. We're kind of complementary at the moment.
Oh my gosh, you're in purple, no way.
Yeah. So
Fully complimentary. Yeah,
yeah,
amazing.
exactly. So I got called the color queen because I just took to color so much. I and I think there's something about color. I just feel like I'm eating it. I can feel like I taste it, and I'm very good at putting colors next to each other. So something that you would actually think probably is going to be psychedelic actually really sits harmoniously together. But so then I said to him, look, I don't want to do any more lessons. I just want to do my own thing with color. And so he said, why don't you just start painting? And the night before my next lesson, I had a dream about, so I was doing research at the time, and it was MRI scans of the brain. And I had a dream of an MRI brain, but it was in color. So I was like, oh my God, that's what I'm going to paint. And so my first ever painting is just MRI of well, it's like an abstract MRI of the brain in color, and the background is in gray rather than the brain being in gray.
Yes.
And I created it including the gray, every single color on it is created from the 3 primary colors and white. So I didn't use any other colors, so it was just mixing, and it's just an explosion of color. But what it made me realize is that I really love the human body. So for me, I love the human body. I think it's such a beautiful creation, but I didn't want to create it in its own form. I wanted to do something really abstract about it. I love shapes, I love color. So I've created, all my art focuses on the structure or the function of a part of the body, and I put it onto paper in my expression, my sort of devotion to how beautiful it is in color. That's all I do. I do contemporary medical art. Yeah, and I love it.
It's so amazing you found your niche, and like completely by accident, and you were about to quit.
Yeah, absolutely.
So going back, how many years ago was this now that you started this journey?
So this was about 8 or 9 years ago. 8 or 9 years ago, yeah.
What do you think you'd say to yourself going back, or if a friend was in a similar position of trying something new and getting to that pivotal point of taking it further or just giving it up?
Oh no, I think we all have a creative spark in us.
Yeah.
And it could be anything. It could be sewing or cooking or whatever. And I think you just need to find that spark and what excites you, and stick at it. And it doesn't matter what someone else says or what they want you to do. Just stick with what you feel inside and you want to do.
That's what I love. You joined structured classes, but you, through your own intuition, found the niche within it that would really help you express yourself. And you just did it all on your own, really.
And it's been amazing because for years I really struggled between my love of humanities and my love of science, and I always thought that they were traditionally separate, and that you could only be one or the other. But this for me has really proved that you can bring the two things together, and I think we might discuss it later, but bringing art and science and medicine together has been such it has balanced me. I am now the most harmonious I've ever been because the two things come together. And then all my friends like Duke and Amal and you have just enhanced that, and I can't tell you what a high I'm getting.
Yeah, it's unbelievable, and just like it's all kind of happened serendipitously, and thank goodness for your daughter, and what a wonderful husband to actually have suggested that to you in the first place. Like, he must know you so well that was kind of like a need within you that needed to kind of be be satisfied. And it's so
unraveled.
you've got this outlet now. And so tell us how you've kind of translated the art as doing something, I'm sure, that's very therapeutic for yourself, but how you've also worked with patients to make it therapeutic for them.
Yeah, so I think it started off as a hobby, and it started off as something that I was doing for mental relaxation. But actually, one of the things that made me realize was maybe a year into, sort of 6 months into when I started painting, I actually got diagnosed with breast cancer. And And actually, I continued painting, and it was extremely therapeutic. And I didn't paint about my journey because it was too raw and not the right time to do it. I have started painting it now, and that journey and that paint, going through that process is really so healing, actually. So I've realized through all of that art is not only good for your mental well-being, but it's also potentially of some benefit for your physical well-being. So I think that it's a big tool, and I think that, and I found some friends that have really supported that fact. So then there were two things that happened simultaneously very recently. One was that I, through SAF, linked in with Amal, and Amal is a GP, and for those of you who don't know, is this GP but a rock star medic. So he's a fantastic musician, and he has done this piece where he's used, I mean, it's complete genius, used his heartbeat as the base of the music, and he was releasing it as a work of music on iTunes and Spotify, and he asked me if I could do the cover album art for it. So so I had a listen to it. I had a sneak preview, and I was completely blown away. It's so great. So please listen out. Anyone who hasn't heard it must listen to it. And basically, I created, while listening to it, I created this piece of art which was on Gray's Anatomy textbook, an abstract heart, which looks like a bit like a guitar. So that's how I met Amal, and he got me my first bit of fame. And then I got involved in a piece of work, a project called Artist, where artist is spelled with the T as a capital T and the I as a 1 to symbolize type 1. So people with type 1 diabetes. And this was an idea by Professor Bhavakar, who's the National Diabetes Speciality Advisor. And he wanted to celebrate the talents of people who have type 1 diabetes, that having a long-term condition like this does not stop you from achieving your goals and being, creative and wonderful. And so we were meant to have a live event in June of last year to, play with people with type 1 diabetes, playing music and dancing and showing off their art. But unfortunately, that was put on hold because of COVID. So I suggested that we moved it to an online event during lockdown and celebrate everyone's beautiful art and uplift the mood. And because everyone was anxious of what was going to happen in the first lockdown. And I was in charge of not only art, but it was like a blessing. I was asked to look after the category of poetry. Yeah. And someone noticed Duke's work on Instagram and said, "Sarah, have you looked?" And it was like 11 p.m. and I really didn't want to be doing this last minute. And I just sat up all night, blown away by Duke's, Duke Al, is his amazing talent, his poetry, his rapping. It's fantastic. So I got him involved in Artist. But then one day I was I was doing a piece of painting, which was a brain, and usually I do the brain and the organ in color, the part of the body in color, and the background is in black and white. And for the first time, I actually wanted to paint the brain black and the surrounding in color, because I wanted to show something to do with like how we were feeling during lockdown, the anxiety and the how we were feeling. And I know that Duke's done a lot of work on mental health. So I suddenly thought, well, wouldn't it be amazing if he could write a poem? And I painted his poem into the brain like it was chalk on a chalkboard. And I showed Duke, and he said, "Oh my God, I can definitely write you a poem inspired by this." And he just wrote such a beautiful poem, which is on my Instagram page. So if you want to read the poem, so fabulous.
I
and
really do. Oh,
I painted the poem onto the brain to look like the folds of the brain. Yeah, so it's a beautiful piece, and and then Nature Medicine last year in December asked if there are any scientists or doctors involved in COVID who use art during lockdown, during COVID, and I submitted this piece, and they featured it in Nature Medicine, which was great. That was very exciting. So yeah,
I bet
so
that was like more exciting than any sort of publication in a scientific journal about like a diabetes intervention or anything. I bet
I,
that's the most exciting.
it was, I mean,
Yeah.
yeah, it was absolutely the biggest thrill of my life to get,
Gosh.
again, it was bringing my love of art with my love of science
Yeah.
together in Nature Medicine, and I was
It's
just blown
so
away.
powerful. It's
So,
so powerful. What have
and
the responses been like? Has it generated any discussion online or amongst
oh,
colleagues?
huge amounts, and I think
Yeah.
what was, huge amounts. Got a lot of interest on social media, and I think the thing that it really highlighted for me was that how you can use art, so art in any form, poetry and painting, to send a health message. So we used it to raise awareness about mental health, and I think that's wonderful. And it's
Absolutely.
when we talk about health, that's so important and integral to us. It's not just about how, reading information sheets or talking to someone. It's about how we can communicate and engage people in different ways, and I think that really works.
Completely. And do you think there's a space for this kind of work around raising health awareness through the medium of art in medical education from an early stage?
Yeah, absolutely, definitely. I think so. I think there's a lot of work with art therapy now happening in hospitals, and I don't see why. And they open it up to healthcare professionals, and why not do it in teaching in medical schools? I think it's really important, and the COVID has highlighted what a strain it is for healthcare professionals looking after people who are unwell.
Mm.
And I think
It's
art is
that
really good at
compassion fatigue. I mean, it's just been a whirlwind, and I actually had a wonderful conversation with a registrar anaesthetist who used photography during the second wave of the pandemic, taking pictures of his colleagues in the hospital wards and really using it as a means to express himself, but then also it helped his colleagues express themselves because they got to choose exactly what location and pose in the way that really evoked their mood. And I just think it's absolutely wonderful that this is becoming more of a thing now, even though COVID's been dreadful, and that people are being more open and the arts are coming more to the forefront as a really important means of communication, but also a means of social connection. And I say this with the absolute joy that the cinemas have opened back up this week, because that's one of my greatest kind of pastimes and my favorite visual art. And I just think it's so powerful, and it's brilliant the community you've created, and to be doing it as a hobby at first and then to be featured in Nature Medicine. It just shows how meant to be your whole journey is, and it's amazing that you're having that impact on so many. So how are you from a day-to-day point of view with incorporating like creativity in your life, even if it's not formal art per se, but how do you kind of incorporate creativity?
Gosh, that's a hard question. You didn't prime me for that one. Well, you didn't prime me for any of them, but um,
Oh,
uh,
that's right.
so that's really hard. I mean, um, so that's a really hard question. I try and do art as much as I can, which is really
Yeah.
hard. But I know that that is very relaxing. But actually, even thinking about my art during the day really
Mm.
helps. So I often will be looking at an image, like an X-ray, and I'll be, oh wow, that would be really fascinating to capture. as a piece of art. So sometimes I do things like that, and for the South Asian Health Foundation I created, they asked, we needed to do an infographics, and I sketched it out, which was great, and then we used it, and it actually looks very similar to the sketch that I did, so that was very exciting. But I think that creativity is really important, because without creativity we can't move forward in medicine, you know, without, or any subject, we can't move forward to create and invent. And so I think creativity is hugely important, and it can come in so many different ways. It can come in the way that we change our consultation skills, how we talk to people, how we interact with people, and even also just, I find that sometimes the way that I open up to people is by talking about my art, or what they're interested in, or what they do, and it builds a relationship with my person with diabetes or whatever. And you know, ultimately, when I'm giving them, when I see them in clinic, I feel like we're a team. I'm suggesting a medication to them, but they've got to be on board with it. They've got to be on board with the lifestyle changes. So by building up a relationship and talking about creativity, I can engage with them and get them on board, and we can work as a team. And that's to tell them we're a team.
Well, I think that's a really good answer, even though you said it was hard, because I mean, what I wanted, you answered it so well with that question, is just, we shouldn't put pressure on ourselves to try and complete things to, a really brilliant, perfect level. You know, how you discussed earlier that you have a thing around perfectionism and having to complete something so beautifully and aesthetically. I think, art is messy, creativity is messy. You can't do these brilliant pieces of work really formally every day, because you're a full-time doctor. And I think if it can just help you think differently and then consult differently, and even, for me, like, I guess I'm the most creative every day when I'm cooking, but sometimes, if I don't fancy being creative, that's fine. And I think it just really offers that option to view things in a really different way and to be more solutions based. And I think that's one of the most powerful things that arts can do in medicine, is that it can actually offer your mind a different route of thinking about a really complex situation. And I love how you've merged it together with your South Asian Foundation work too, and you're a graphic designer all of a sudden.
You should come and see my kitchen. That's also a piece of art.
Oh my god. I can't talk. I'm not a neat person per se, so
no, because I've always living in hospitals. It's always very clinical and white, so my house is all very, very colourful, because I want to be able to walk in and go, welcome to Sarah's museum.
Oh wow! So that's what you meant. I thought you were making a joke about being messy. So your kitchen.
Oh no, I'm not messy.
Well, I've just told everyone mine is. But tell us about it. So what makes it so colourful and museum-like?
Oh, so okay. For example, I got the cupboards were, when we bought them, they were all oak, and we got them hand painted. So they're specifically bought the wood so that they could be painted. So they're painted. The vast majority are a teal blue, a dark teal blue, but the island is the cupboards of the island are a sort of burgundy pink colour.
Oh, wow.
And then we've got copper splashbacks, which go with obviously the blue, because it's complementary, blue and orange. And then we've got a wall, which is the original outside wall. And you know how usually people have brick walls as a feature?
I've actually got that in my flat.
So I wanted to do that. And then the builder said, Sarah, you're coming up with really crazy ideas. Why are you doing the same thing as your neighbours? Like, the same thing as the Joneses. So I was like, okay, what can I do that's different? And basically we've got a whole wall of copper pennies.
You're joking.
I'm not joking.
Were they yours? Did you collect them? So as in tiny 2p copper pennies?
They're one p's. Although we have hidden inside a couple of European cents and American cents, so you have to find them, but the rest are all pennies.
Oh, you'll
Yeah.
have to take a photo and show it to me.
Yeah.
Is there glass over it? Like, what's the texture
It's,
like of the
it's
penny?
a sort of, part glossy finish lacquer. So, and then we've got light shining on it. So, yeah.
That is so cool. Oh my gosh. It's so funny. I bet people like come and it's like if I had a penny for every Oh
Yeah.
my
Well,
god.
so we've only just finished it because of lockdown, because of COVID
Yeah.
on hold. So we started work before COVID. So no one's actually come and seen it yet. So yeah, you'll have to come.
That is
You don't
such
live far, so you should
yeah,
come down and see it.
defo. That's such an exciting feature. Gosh, wow.
Yeah.
And so I'm just aware of the time. So tell us like where you want to kind of see art going within the healthcare in the future. What's your vision if you could kind of change the culture around merging the two worlds together?
So I think I so there are two things that I would love to see. Is that I would love to see it as a part of complementary medicine, really like an integrated. I know we use it's there, but I think it should become a bit. It's not to replace medicine. It's adding to it. So,
Mm,
and I think having that for patients, whether that be in terms of treatment or in terms of trying to engage them and educate and give the information. I think it's a great medium to bring people together,
mm,
and people can express their vulnerability through the art. They may not want to talk about their vulnerability and how they feel, but they can express it through their art, and that's often very much more powerful.
so
Um,
beautiful that. Mm.
and I think
Do you think that that makes you more of a team? Do you ever talk about your own vulnerability with your patients and how you've expressed yourself through art? Do you think that makes you more on an even playing field when you're having that consultation and it becomes more of a shared partnership?
Yeah, absolutely, absolutely. I don't
Brilliant.
tell everyone, but when I've needed to, I do tell, because I think it is important, especially when I found some people might be struggling or questioning in certain ways. Then I found that it's really helped them. And in fact, yeah, last week I heard that I lost one of my people with diabetes, and we had actually bonded on this very topic.
Oh,
Um, and he had said, "Thank you so much for sharing your story, because that really
mm,
helped me," at a subsequent consultation. But I found out last week. I was very sad to hear that, yeah, he passed away.
very sad.
Yeah, so it does.
Yeah, it's so fascinating how the arts can really help reduce stigma, because I feel like they really can be an equalizer. You know, you don't have to be a fine painter who has been trained at, the top art schools. You can literally be self-taught or go to a couple lessons and pick something up. And I think it's just so wonderful that you were able to kind of have that bond with that patient, and I'm sure others. And it just kind of shines a light on how important it is to talk about vulnerability, and that it's not always a weakness. I feel like, it's this whole concept of doctors are superhuman, they don't have feelings, that almost kind of like robotic in there to just kind of give. And I just think it's amazing that like the culture is obviously changing around being able to share your vulnerability, but in a very, structured way. And yeah, I'm really passionate about that. Like I'm an ambassador for UK Doc, which is a brilliant charity all about mental health support for doctors and reducing the stigma around asking for help. And I just think that if you can have that interaction with a patient, like it's very profound. And I bet it wasn't done, in the previous generations at all.
Yeah, and I think you've also just said that was going to be my second point, was the vulnerability of healthcare professionals. Like, we've always been shown to be the strong one, taking, listening to your stories of you're unwell, but also the ones that see that, say someone's passed away and certifying death, but we're not, we are vulnerable, and we should be able to show it, and art
Absolutely.
is a way to unite us.
No,
Yeah.
and And thank you so much for sharing with myself and the audience about your experience with breast cancer, because I think it's so important to discuss all these vulnerabilities, whether it's, you know, I've suffered from depression, so my mental illness vulnerability, if we want to call it, your physical health vulnerability. I think that, you know, with all the doctors who've got autobiographies out at the moment around Doctors Get Cancer Too, there's a brilliant book out. I think it is so important to be able to openly discuss, you know, with obviously your own kind of limitations around it, so you know there's self-preservation, so but to discuss those like vulnerabilities so that you're not always having to perform and put on that mask. And exactly what you've said, doctors are patients, patients can be doctors. It really is quite interchangeable. And art, luckily, whether it's through the medium of writing a book about your lived experience or painting it like you are at the moment as a healing journey, it's such a wonderful equalizer, and it's truly fantastic. And so in terms of the communities that you see who are perhaps you know, from lower socioeconomic classes, and there's a bit of health inequality there, how do you think the arts can potentially be made more accessible for people who are from those backgrounds?
Well, so we all know that South Asian, sorry, you might hear my son playing the recorder in the background. I don't know if you can.
No, I
but,
can't hear it actually.
So well, South Asians, for example, let's take South Asians because I know them best, having lived experience. But you know, South Asians love Bollywood, right? We love dancing, and we love Bollywood, and we love music, and there's a lot of art forms in all communities, but in South Asian communities as well. And so it's a very good way of like the if I can be controversial, the healthcare system as we have at the moment has been created for a particular type of person, and that's usually a white male middle-aged person accessing healthcare.
Not
And
controversial, it's just the truth.
yeah, it's true.
Yeah.
It's true. I mean, yeah, it's true. But you know, some people might disagree with it. But you know, it is what it is. It's very easy for some people to access it. It's harder for other people to access it. But using different, just if we start to think outside the box, and that's what art helps us do, is to start thinking outside that box and being creative, and getting people to understand health and disease in a format that they can relate to and approach something that is could be surreal or you know, hard to comprehend, is I think a really good way of bringing people to healthcare and to educate them. And we know community projects like this work. You know, there's things like even like there's work on, you know, people do little short clips, dramatized clips, and people in different languages, and people enjoy watching them, and that can help health awareness. And people do things like community share a meal, so the community go in and they share a meal, and then they talk about health, and they talk about diet. So they're just different ways of thinking out of the box, and taking complex ideas to the community in a way that they can digest it and understand it and relate.
Absolutely. And have you managed to get kind of any of your colleagues on board? Have you managed to kind of encourage people to kind of get that creative spark within them and move away from just, you know, applying biomedicine all the time?
I think, yeah, definitely. I think we've seen some interest on social. I mean, not necessarily my colleagues, but on social media, the people I interact with, and some of the other groups. I've seen this, and Amal's working with the South Asian Health Foundation Fellows, and there's a lot of interest in this art, and it seems to be like a tide is turning.
Yeah, that's really good.
And people are really getting excited about art and how they can bring it into medicine or into their lives, and enrich not only them but the people around them, which is great.
Completely. Yeah, I'd love to see, because you know last week was Mental Health Awareness, and Mental Health Foundation chose nature as the theme. I'd love to see next year like creativity or the arts being chosen, and you know the light can really be shone on just how powerful arts can be for well-being, for, like you said, physical and mental.
Well, yeah, so one of the things I didn't mention was that the artist project that we did, we won a QIC award for it, so Quality in Care Diabetes award for it, and that just shows how,
Yeah.
you know, it's appreciated, it's recognised, and it's getting out there. And we've also been the same project has been shortlisted for the Royal College of Physicians Excellence in Patient Care Awards. So, you know, I think the tide is turned. I think people are appreciating that there's something, and hopefully through this will also encourage it to happen.
Absolutely. I think that's actually amazing that it's been recognised from such a high level, because it just shows that this thinking outside the box, you know, if you give people solutions, then they can really kind of digest it and get excited about it. And hopefully, you know, that cultural shift really will happen.
Yeah, absolutely.
Yeah, and so just to finish up, where can people, obviously on this Instagram, but where can people see more of your artwork? Or is it mainly Instagram or other mediums that you want people to check you out on?
So I'm obviously on Twitter. I'm on Twitter most of the time, but on Twitter I generally do a mixture of medicine, art, and, you know, life. Instagram's at the moment the main place where I do my art. I am in the process of getting a website sorted out, which will house more of my artwork. Once the COVID restrictions are really, you know, once we're back to normal, I'm going to have an exhibition
I'll definitely
of my art, which of course you're invited to, and anyone else that wants to come, please let me know. You know, Amal will be there, and so will Duke. I'm hoping. And then the other thing is if I'm allowed to say, I don't know if Duke's still on, but Duke and I are collaborating on a project which will be hopefully released in September, which is a book of his poetry, and I'm helping illustrate it. And I've been collaborating with projects with Amal and Duke, and anyone else wants to collaborate, please do. And then we can move forward with art and health and art and life in general.
This is so exciting. Oh my gosh, I cannot wait for this. And I've just thought of a really important person that I need to introduce you to, who's doing art stuff around neurodiversity. So,
oh, wow.
Yeah, definitely, you know, with your brain art and all of that, it sounds amazing. And oh gosh, what a great chat. Thank you so much, Sarah. Sorry I've been calling you Sarah, by the way. I really
don't worry, it's my parents' fault, they put the H on the end. But yeah,
yes, I thought without the H as Sarah and with the H as Sarah, but you just always need to ask.
Yeah, no, it is meant to be, it's meant to be Sarah, but they put an H at the end, but I answer to both, and it's the same name essentially.
And it's quite cool because you're Dr. Ali and I'm Dr. Ali, but obviously
I know.
First name and last name difference.
And we live down the road from each other.
I know. It's been so lovely chatting, and I think,
and you too,
honestly, our audience has absolutely loved it. And you know, I would love to stay in touch and hopefully do another one with you and Duke, because you know you can now do more than one interviewee on an Instagram live. So with you and Duke, it would be amazing to chat.
Oh, that would be amazing. We can show you the painting. Yeah.
Oh God, that would be amazing.
And the book if it's ready.
And have a lovely evening. I'm so glad that it all worked out in the end after my ditziness with the tech and the timings.
I'm so sorry of my failure for the computer, but thank you so much for inviting me. It's been an honour, honestly.
Oh, and you, so lovely chatting. Lots of love. Good night, everyone.